Hi, I'm Michaela. I chose to do my presentation on lupus. Lupus is a complex and chronic autoimmune disease in which your immune system that usually fights infection is actually fighting healthy cells instead. Your malfunctioning immune system results in a wide range of symptoms. The most common are inflammation and pain. It's not a contagious disease, but it can be hereditary and it can also affect anyone. There are 4 different types of lupus. The first one is systemic lupus erythematosus, which is the most common type. Cutaneous lupus, which only affects the epidermis. Drug-induced lupus, which is a form of lupus caused by prescription drugs. Neonatal lupus, a condition that affects infants of women who have lupus. The signs and symptoms of lupus differ from person to person, so it can be hard to diagnose. Symptoms can be sudden or slow, mild or severe, and could be temporary or permanent. Symptoms will depend on which organs are affected. People can also experience seizures, restriction of blood flow to the hands and feet, sensitivity to the sun, depression, gastrointestinal problems, bone thinning, weight changes, and dryness of the mouth and eyes. Most people with chronic lupus go through episodes of symptoms called flares. Flares are commonly triggered by environmental factors like stress, weather, and infection. Lupus is a tricky disease to diagnose because there is no singular test that confirms it. Instead, clinicians will check several factors to determine the diagnosis. A person with 4 or more of these conditions can be classed as having lupus. Photosensitivity, a rash across the cheek to the other cheeks and over the bridge of the nose. Cardiopulmonary inflammation, a positive anti-nuclear antibody test, kidney problems, nervous system problems like unexplained psychosis or seizures, increased autoimmune activity, oral or nasal cavity ulcers that are usually painless, blood issues such as anemia or reduced white blood cells and/or platelet count, joint swelling or stiffness, and raised red patches over the skin. The tests required to diagnose lupus are anti-nuclear antibody test, or ANA for short. This is an antibodies test to see proteins which attack your body's own tissues. Lupus patients will usually have a positive ANA, but there are other reasons for a positive ANA. So by itself, it doesn't confirm lupus. This test is done in a serum separator tube. An ECG will be requested to see a heart rhythm. An ESR test, which stands for erythrocyte sedimentation rate. This test gauges how much inflammation is in the body. This is done in an EDTA tube. A CRP test, which stands for C-reactive protein. CRP is released by the liver into the bloodstream soon after inflammation starts, and there will be increased amounts of that in your blood. This is done in a serum separator tube. A liver function test will be done to determine healthy function. This is also done in an SST tube. A full blood examination will measure the red and white blood cells and also platelet levels. This test is done in an EDTA tube. A chest x-ray will be done to see if there's any damage, and a urinalysis will be completed to see increased proteins or red blood cells in the urine. As there are no cures for lupus, the main treatments are medications. Medication will depend on your signs, symptoms, and severity. There are multiple types of medications used, such as immunosuppressants, biologics, anti-malarial drugs, and non-steroidal anti-inflammatory drugs, such as aspirin. There are also self-management ways to treat lupus. 1. Limit sun exposure. 2. Exercise. 3. Supplements such as vitamin D. 4. Learning about the condition and what works for you. And maintaining your weight is important. The 5 medical terms that I used are cutaneous, anemia, rheumatology, gastrointestinal, and neonatal. The prefix for cutaneous is cuten, which means skin. The suffix is us, like OUS, which means pertaining to. Anemia. The prefix is "an", which means without. The suffix is "emia", which means condition of the blood. Rheumatology. The prefix "rheuma" means flowing, and the suffix "ology" means study of. Gastrointestinal. The prefix is "gastro", which means stomach. The root word is "entero", which means intestine. The suffix is "logy", which means study of, ology. And neonatal. The prefix "neo" means new. The root word "nat" means born. And the suffix "al" means pertaining to.